Antipsychotic medications, mechanisms, indications, and considerations. Introduction. Antipsychotic medications, also known as neuroleptics, play a crucial role in the treatment of various psychiatric disorders characterized by disturbances in thought, perception, and behavior. This essay aims to provide an educational overview of antipsychotics, exploring their mechanisms of action, indications, potential side effects, and considerations in clinical practice. Mechanisms of action. Antipsychotics primarily act on the central nervous system, targeting neurotransmitter systems to alleviate symptoms associated with psychosis. The two main classes of antipsychotics are typical, first-generation, and atypical, second-generation, agents. Typical antipsychotics, such as haloperidol and chlorpromazine, primarily block dopamine D2 receptors, thereby reducing the excessive dopamine activity implicated in psychosis. Atypical antipsychotics, like olanzapine and risperidone, act on multiple neurotransmitter systems, including serotonin, dopamine, and glutamate, offering a broader spectrum of efficacy. Indications. 1. Schizophrenia and related disorders. Antipsychotics are the cornerstone of treatment for schizophrenia, helping manage positive symptoms like hallucinations and delusions, as well as negative symptoms and cognitive impairments. 2. Bipolar disorder. In bipolar disorder, antipsychotics may be used in conjunction with mood stabilizers to control acute manic or mixed episodes and prevent future episodes. 3. Major depressive disorder with psychotic features. When psychotic features are present in major depressive disorder, antipsychotics may be prescribed as an adjunct to antidepressants. 4. Psychotic disorders in elderly patients. Antipsychotics can be utilized cautiously in elderly patients with psychotic disorders, although careful consideration of potential side effects is essential. Side effects and considerations. 1. Extrapyramidal symptoms, EPS. Common side effects of typical antipsychotics include EPS, such as tremors, rigidity, and tardive dyskinesia. Atypical antipsychotics are generally associated with a lower risk of EPS. 2. Metabolic effects. Some atypical antipsychotics are linked to metabolic side effects, including weight gain, dyslipidemia, and an increased risk of diabetes. Regular monitoring of metabolic parameters is crucial. 3. Prolactin elevation. Antipsychotics, particularly risperidone and paliperidone, may elevate prolactin levels, leading to side effects like gynecomastia and amenorrhea. Monitoring of prolactin levels is recommended. 4. QTc prolongation. Certain antipsychotics, like ziprasidone, may prolong the QTc interval, necessitating regular electrocardiogram monitoring to prevent potential cardiac complications. Conclusion. Antipsychotic medications have revolutionized the treatment landscape for various psychiatric disorders, providing relief from debilitating symptoms. However, their use requires a thoughtful approach, considering individual patient characteristics, potential side effects, and the specific nature of the psychiatric disorder. Ongoing research aims to develop newer agents with improved efficacy and fewer adverse effects, enhancing the overall care and well-being of individuals with psychotic disorders. In clinical practice, a collaborative and patient-centered approach is essential to optimize outcomes and minimize the impact of side effects associated with antipsychotic treatment.